Oh, gee, it's exploding. I mean, it's when you think about what's happening now. I think in the end, I don't know in the end, but I think vaccines are now kind of they're new avenues for trying to make vaccines, and vaccines for a lot of different diseases. I think the now that you know, it's not so many years ago that we didn't understand what something we used to talk about an innate immune system and an adaptive immune system. Yes, innate means just what we have, and innate adaptive means what we generate in response to the microorganisms. But we didn't know anything about the innate system, and we used to talk about it and say, we teach it to students in like 5 minutes and say, well, it's tears, it's a few things that somehow help prevent bacteria from growth. And so, but now we know so much about the innate immune system and how it directly interacts with the adaptive immune system. And so and how this innate immune system is becoming so essential in a lot of different diseases. And so I think now that understanding, as well as the understanding, the other major piece I would say is with the microbes. Of course, I'm a little bit biased about the microbes, but I think it's becoming so clear that the microbes that we have at any one time in our gut, for example, drive many different, probably they're responsible or at least contribute to a lot of different diseases that we never thought about. I mean, obesity, probably maybe even some cardiovascular diseases. I mean, the variety of things. So I think that and now we can do the sequence, the microbiome, so to speak, right? So we can know about all the bacteria that are in our gut or in any other area. And start correlating that with different diseases. And I think you're going to see a major impact of that on the immune system, because those bacteria certainly affect the immune system. The whole thing is, one major thing is we have bacteria. We have what some people call good bacteria and bad bacteria, or we call good bacteria as commensals, or sometimes beneficial microbes, versus the pathogens, right? And so the question is still, I think one of the most important questions is, how does the host know when it sees a microorganism, when it sees a bacterium, how does it know whether it's a good one or a bad one? And so we still don't understand, but that's all intimately involved with the immune system. So I think we're going to end up being able to treat probably a lot of these kind of chronic diseases that have really not been able to treat before.